Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today I want to discuss a very, very important topic that has come to light recently in scientific research by Johns Hopkins University. And I want to talk about how this affects real people every single day, including my own family recently, about medical errors and mistakes being the third leading cause of death in this country. First is heart attacks, second is cancer, and third is medical mistakes or errors being made, like drug interactions, mistakes in hospitals, people taking medications that they have adverse side effects with over a period of time that's causing kidney disease, dementia, Alzheimer's, all kinds of different adverse reactions to pain pills, muscle relaxers, opioids, for instance, and the consequences of traditional orthodox medical care versus chiropractic being very safe and effective for helping a person to naturally function properly, as opposed to putting something from the outside in or taking something out of the body. We're working with the body, not putting anything into it or taking anything out of it, but we're just allowing the body to heal itself better through chiropractic adjustments and improved neurological function. And I wanted to have Violet with us on this one today because she's a good example of that. She's had an acid reflux and hiatal hernia for years, and she's been taking these PPIs, which are proton pump inhibitors, for how many years?
Oh gosh, probably 15, 20 years.
15, 20 years. And she came here to try to get a natural resolution to this issue. And she's only been here once so far, and she's already seen a vast improvement just in one visit, correct?
Yes.
That's good.
Much improved.
So, I know there's going to be a lot of interesting comments on this one, because I'm going to name it the third leading cause of death in the country is in the U.S. is medical mistakes. There's probably going to be a lot of controversial MDs coming on here and saying stuff that we're the quacks, but who's the real quacks here? Let's take a look in the mirror here. Okay, hon, I'm going to have you flex your head forward and then backwards, and then neutral. Yep. Okay, see how your head's still a little forward to the right?
Yes.
Now, also, you just come here one time, but the one time you came here, how much time did I spend with you versus what your medical doctor spends with you when you go see him?
A lot longer.
I mean, and I was all hands-on the whole time.
Yes.
They hardly ever get out of their chair to see you. They sit there and write prescriptions and recommend you go get MRIs and then surgery or shots, ESIs.
Oh yeah, you're lucky if you get 10 minutes.
Yep.
You have to write all your questions down so you can make
beforehand,
sure.
so you don't take their time up. Okay, very good. So, Violet, today I am going to decompress your whole spine for the first time.
Okay.
So let's come over here and lay on your back. And I'm going to have you put your legs there and head up this way. And we're going to slide down this way just a little bit. There you go. Okay, I'm going to put this right on top of your hip bones here.
Okay.
There we go. Good. Now you can Google this and find out what I'm talking about. Johns Hopkins researchers published just about a month ago that the third leading cause of death in the U.S. is medical mistakes. Now the CDC knows all this, but they don't really track that through death certificates. Take a nice deep breath in. Let it all the way out. And drug companies and pharmaceutical companies hate hearing about that. You felt that all the way down, didn't you?
I sure did.
Yeah, that was a pretty heavy duty adjustment, wasn't it?
Yes.
Good girl. Well, you did great on your first ring there. Okay, just let your air out and relax in my hand. Okay. There. MDs are always talking about how chiropractors are quacks and give people strokes and all that. That happens so rarely. Our malpractice insurance is next to nothing compared to medical doctors. and for a very good reason. Okay, let's come over here on your tummy now. Let me help you. There we go. We take our patients' health very seriously here. And what chiropractic is really health care. What medicine is sick care. We're providing a service that helps people feel better and function better naturally, as opposed to trying to get rid of the symptoms with a pill or shot or surgery. Now I'm adjusting her SI joints, and I noticed a few comments that said all my adjustments look the same. Well, they may look the same, but as Joseph can tell you, they're a lot different because every patient's joints are lined up differently, their muscle tone's different, their ligament tone's different, their spine's in different configurations. So the angles, the pressure, the thrust are unique to each and every patient. Oh boy, you're moving great. Yep, right here. Yep. That's where you've been the most sore, huh?
Yes.
Right where the hump is.
Yes.
Now she's beginning to get a little bit of what's called Dowager's hump right here, but that's not because it's hereditary. It's because her head's been forward in her posture for so long. So we're going to put the curve back in her cervical spine this way. There we go. That's it. Good. Okay, let's turn you on your back now. Now you go to the chiropractor to get well. If you go to the hospital, you could die. In fact, more people die in hospitals every day than die in a chiropractor's office every year, which hardly ever happens. There. Okay, and you're going to feel your legs relax here. There you go. You should have felt that all the way up into your back, did you?
Yes.
That one too?
Yes.
Okay, now I'm going to have you take a real deep breath in. Let all your air out. I'm going to grab the top of her stomach and I'm going to pull that straight down. Okay, another deep one in. Let it all the way out. And one more time, please. Excellent. Very good. Now, I'm going to get your neck one more time up here to get that curve back in it. Just like that. Yep. One more. Good. Okay, let's slide straight down this way now.
Okay.
Right there. And put your arms straight out to the sides for me. I'll be adjusting your sternoclavicular joints, your AC joints here in your shoulders, and your ribs up in front so that they can start holding the diaphragm properly to keep your stomach down there where it's supposed to be. There we go. Now your rib cage was a whole lot lower on the right, and you can see right now it's even. That's only after 2 visits. That's great. Okay, let's sit you up and face towards Joseph there. So when you're making your healthcare decisions and choices, ask yourself, do you want to take a pill to cover it up or hide it, or do you want to get to the underlying cause of the problem? Because the cause of her acid reflux and hiatal hernia is not too much stomach acid. It's that stomach acid's getting up into the esophagus. And that's what we're treating as the underlying cause, not just the symptoms. But the symptoms get better when you correct the underlying cause. Right?
Right.
There we go. There we go. Okay, let's stand you up here in front of the mirror again. And I'm going to have you flex your head forward and then backwards again. Yep. Now see, we're going to pull these up and back. If you'll hold those like that for me.
Okay.
Flare these like this. And then we're going to bring your head straight back, and we're going to translate you to the left because you're right. Shift your pelvis straight right now. Hold it over there as far as you can. A little tap there. Keep it way over there. Another little tap there. Now relax. Okay, let's try that same thing again. Now this should feel a little smooth all the way back to, and then back to neutral. Now see, you're more centered up now. You're still a little far and right, but not near as bad.
Right.
And you're centered up here a lot better. And you should feel better already.
I do.
Very good. So this is your Houston chiropractor and Violet coming to you from Advanced Chiropractic Relief in Houston, Texas. And we'll see you next time.